Good morning everyone. Today we are discussing one important experiment in the physiology, and that is the clinical examination of radial pulse. When we say pulse, what is the meaning of pulse? So the meaning of pulse is that right now this ventricle is filled with the blood. The aorta and the arterial system is also filled with the blood. Now the ventricle is contracting, blood is injecting into the aorta, and aorta undergoes expansion. This is how the aorta undergoes expansion when the blood is injected into the it. Now this way of expansion, it moves along the length of the arterial system, and ultimately it comes to the peripheral part, and there we feel it, and that feel is known as the pulse. That way of expansibility, it is known as the pulse. So this is the meaning of what pulse. Now the next thing is that which artery we should examine for the clinical examination of the pulse. Many arteries are present in our body, but for this clinical examination, the artery that is being examined, it should fulfill certain criteria. What are these criteria? Number one, the artery should be superficial. Number two, artery should be easily accessible. Number three, both the patient and the examiner, they are comfortable, or it is convenient for them. And number three, the most important one, the artery should present in front of the bone. Remember, artery is best palpated when it is pressed or when it is palpated against the bone. So who is fulfilling all these criteria? These are fulfilled by one artery, and name of that artery is the radial artery. It is superficial, convenient to use, and it is easily accessible, and it is present against the bone, and name of the bone is the radius. So now today we discuss how to examine the radial pulse. So during this examination of the radial pulse, we just do not count only the how many beats are present per minute, that is what is the pulse rate. Actually we examine many points, and among these points they are: number one, what is the rate of the pulse, what is the rhythm of the pulse, what is the volume of the pulse, what is the force of the pulse, then tension, and then how is the condition of vessel wall, and is this pulse equal on both sides or not. So these are the points in which this clinical examination of pulse is described. So first one, what is this rate? Rate means the number of beats that are occurring in 1 minute. The normal pulse rate, it is around 70 to 80 beats per, it is around 60 to 90 beats per minute. When the pulse rate is increased above normal, that is 90, it is then known as tachycardia. When the pulse rate it is decreased below 60 beats per minute, it is then known as the bradycardia. So this is the rate. Then second is the rhythm. Rhythm is what? There is the radial pulses are being recorded. Are these subsequent radial pulses, they are at the equal distance or at the fixed distance? If as, then the pulse is regular. That is, the rhythm is regular. But if the beating of the heart is not regular, and it is then known as the irregular rhythm. This is also known as arrhythmia. Now in the irregular rhythm, two types of irregularity are there. If this heart is beating and suddenly there is a cessation of beating, again there is beating, again cessation. If this is fixed, then such type of irregular rhythm is known as regularly irregular rhythm. And if these beats are occurring alternately, there is no any fixed interval between the successive beats, then this type of rhythm is known as irregularly irregular rhythm. So the normal rhythm, it is the regular rhythm. If it is disturbed, then it is known as the irregular rhythm. Irregular rhythm, it may be regularly irregular or it may be irregularly irregular. Then, volume of pulse. What is volume of pulse? ध्यान से देखो अभी. This is the aorta, or this is the peripheral artery, and this peripheral artery is containing the blood. Now, when it is containing the blood, it is actually exerting the pressure, and that pressure is nothing but the diastolic blood pressure. Now the heart is pumping the blood is injected, a wave of expansion comes, and this wave of expansion is now lifting the wall of radial artery by this magnitude. Okay, so when this wave of expansion comes, there is now systolic blood pressure has come into the picture. So there is the upliftment of the blood because of there is the upliftment of the wall of the radial artery because of the systole. So this volume of the pulse, it denotes but the difference of systolic blood pressure and the diastolic blood pressure. And we know difference between systolic and diastolic blood pressure, it represents what is known as the pulse pressure. What it is known as the pulse pressure. So what is the significance of volume in the pulse examination? It determines what is called the pulse pressure. Normally, with the blood pressure of 120 by 80 millimeter of mercury, we record that the volume is moderate. But if there is more increase in the systolic blood pressure, then the pulse pressure will increase, and we label it that the person may have what is known as the systolic blood pressure. Then, for this force, for the time being, force, it gives the rough idea about the systolic blood pressure. Tension, it gives us the idea about the rough idea about the diastolic blood pressure. Then what is the condition of vessel wall? Is it soft and elastic, or is it rigid and like the rope? So if it is soft, in healthy individual, it is soft and elastic. And in the old days, because of the arteriosclerosis and because of atherosclerosis, it becomes hard and it is like a rope. So this is how we can guess how is the condition of vessel wall by just palpation. Then all these points, they are examined on the other side, and we see whether the pulse on the other side is equal or not. So these are the points which we examine in the examination of the radial pulse: rate, rhythm, volume, then the force, tension, condition of vessel wall, and followed by the equality on both sides. Now we have the demo of how to examine the radial pulse. The first and very important thing is that the subject or the patient must be completely relaxed and comfortable. And the second one, the examiner should also be the relaxed and the comfortable one. Always stand on the right side and always use the right hand for the examination of radial artery. So how radial artery is examined? For that, we are having certain position of the forearm. The forearm is semi-prone. It is semi-pronated, and the wrist joint is slightly flexed, and the fingers are kept loose. Now, why this position? This position, it is because in this position the radial artery comes exactly in front of the radial bone, and we can feel the radial artery very effectively in such position. Now, position is over. Now how to go for all these points? Examine the radial artery for complete 1 minute. And what is to be done in this 1 minute? ध्यान से सुनो. In the first 30 seconds, concentrate on the first 3 parameters. That is the rate, then the rhythm and the volume. And in the next 30 seconds, concentrate on the force, tension and the condition of vessel wall. Now, for the examination of the radial artery, we use 3 fingers. tips of the three finger they are used, index, middle and the ring finger, and they are kept over the radial artery. Now the ring finger, it will obliterate the radial artery. Why this ring finger is obliterating the radial artery? Because we are preventing the retrograde movement or the arterial pulsation coming from the palmar arch. Because of this, now our two fingers, that is the middle and the index finger, now they are sensing the beating of the radial artery or the pulse of the radial artery. Now, for the first 30 seconds, we will concentrate on how much is the rate. Start counting the number of beats. Simultaneously check whether these beats are occurring regularly or there is any irregularity. At the same time, also check whether the uplift movement of the wall of the vessel is moderate or it is more or it is less. So rate, rhythm and volume, they are now determined. Now we come to the force. We know force determines gives the rough idea about the systolic blood pressure. What is to be done to determine the force? These two fingers, that is middle finger and the index finger, both of them, they are now feeling the pulse. Obliterate the pulse with the help of this index finger and see how much pressure is required to obliterate the radial artery so that the middle finger doesn't feel the pulsation. The pressure that is required to obliterate the radial artery completely, it gives the rough idea about the systolic blood pressure. Got it? Now, next point is the tension. The two beats are there. The first beat and the second beat. These two consecutive beats are there. There is a gap between these two beats. During this gap, check whether it is rigid, that means high tension, or whether it is soft and flabby, that is low tension, or whether it is moderate tension. So tension is determined during the gap between two successive beats. Something difficult to assess, and it comes with the practice. So normally when the blood since tension, it denotes the diastolic blood pressure, we say, and if the diastolic blood pressure is normal, we say that tension is moderate. Now the condition of vessel wall. The ring finger is now as usual obliterating what is called the radial artery. Then obliterate the radial artery with the help of the index finger. No pulse is felt by the middle finger. Press the radial artery with the middle finger and roll the segment of radial artery over the bone and check whether you can feel the wall of the radial artery or not. In the normal healthy individual, we cannot feel the wall of a radial artery because it is soft and elastic. But when the person is suffering, but in the old age person, where there is the development of arteriosclerosis and the atherosclerosis, the artery, wall of artery is felt as a hard one and like a rope. So this is how the pulse is examined on one side, and do exactly the same thing on the other side. That is, for first 30 seconds, check for what is called the rate, rhythm, then the volume, and later on after 30 seconds, check the force, check the tension, and check the condition of vessel wall by obliterating the artery and rolling it over the radial bone. Now, once it is over, the examination of radial artery is completed. The examination of radial artery is completed. What mistake is done by the student is that while reporting they just say the rate is 78 beats per minute. This is not the way. We have to describe all these points in the reporting of the radial pulse. Now, what will be your reporting? On examination of the radial pulse of the given subject, the rate is found to be 76 beats per minute. The rhythm is regular, volume is moderate, the force is also moderate, tension is also moderate, condition of vessel wall is elastic and soft because it is not palpable, and the third one, the last one, the pulse is equal on both the sides. This will be your report.